Hello. So I wanted to touch base with my follow-ups. Um, this is actually my second follow-up with my plastic surgeon. So the first one was fine, if I can remember. This one was actually supposed to take place tomorrow. It was supposed to be 2 weeks after my last follow-up, which would have been tomorrow, but it had to be pushed forward because not last night, but the night before, I stretched in my sleep and everything went extremely painful, and I just convinced myself to continue to stay asleep. And then when I woke up, there was blood all over my t-shirt, and then I kept bleeding throughout the day. I was using gauze to catch the blood and everything. So I called his office this morning at 8 o'clock this morning, and they were like, can you come in today instead of tomorrow? And he looked at the wounds. He said, it looks like you opened it up, the incision, a little. He put some bacitration of polysporin on it, put some gauze on it, and said for me to continue to put polysporin or neosporin or something like that on it, and to keep redressing the wounds. I asked him about projection because you can't, I don't know if you can tell here, this breast, which is the one that wasn't reconstructed, is much larger than this one, and it projects out more. So I asked him, would I ever get projection from the reconstructed one? And he was saying that projection is the hardest thing to achieve, that especially in my case, because I don't have any fat. He was saying that, the best way to get projection and everything like that would be to do a fat transfer, so to liposuction fat from somewhere and place it in the breast. But he was like, you have no fat on you. So he was like, the next option would be to take my lat muscle, which we've talked about this before, and that's the surgery I don't want to do because it's extensive. But it would be to take the muscle from my back and build a breast out of it. But right now he said, let's watch and see what happens. So right now this breast is just dwarfed. It's just a tiny little thing. I don't know if it'll ever be a breast, but we're still new in this. It's almost been a month since surgery, so still fairly new in this whole reconstruction. So I guess things still have to drop and fluff, and see if my skin will stretch and expand and everything like that. He said it was definitely not worth me gaining 50 pounds just to build a breast out of. But he said, give it some months, we'll continue to watch it, and I guess if all else fails, then he has to do that latimus transfer, which is transferring the muscle from my back and building a breast out of that. One more follow-up. I did follow up with my oncologist 2 weeks ago, maybe last week or 2 weeks ago, something like that. And everything there looks good. I learned that you don't have to do CT scans every 3 months or 6 months, whatever have you, which I thought I would have to do. But since medical science is just a practice and is constantly changing, they found that doing CT scans every 6 months brings a whole lot of unnecessary stress onto the patient, that a lot of times they don't catch it sooner. It doesn't change the medical treatment plan, this, that, and the other. So it's just in the best interest of the client not to do those every 6 months or whatever have you. So I don't have to do those. Yay. And he asked me about my hot flashes, which I thought was interesting because I had just noted that I don't have hot flashes like I used to. And I remember I just vaguely thought about it. I'm like, I don't know if it's just because I'm so used to the hot flashes or if I really stopped having hot flashes. So when he asked about it, I was like, oh, I was just thinking about that. And I don't remember the last time I've had a hot flash. And he was saying that, that's, typical. He was like, that's a sign that your ovaries are probably waking up. So I was like, yes. So it's like, hopefully, maybe, I don't know, I can expect a period soon. I don't know. We'll see. Haven't seen one since May. We are approaching March. So, but that's everything with my follow-ups. Yeah, that's everything with my follow-ups, guys. All right, so bye. So this is a follow-up to my follow-ups. I figured I needed to do this. Let me turn this TV down. Just because, like, if I don't do it now, it'll never get done, and I just haven't felt like doing it. So in the previous video or previous clip that you just saw, I was leaving the plastic surgeon's office. I was still in the parking lot of the plastic surgeon's office, and I had gone because my incision opened a little, and he did what he did that day and was like, follow up in a week. Then I want to say 2 days went by, and ow, maybe it was 2 days, a day, I'm not exactly sure. But you see, I sleep in these like white t-shirts, and I woke up and there was like blood all over the t-shirt, and I went and I was changing my bandages, and when I took the bandage off, I noticed that the incision completely opened. Like, it looks like a little vagina underneath my breast. So, it's disappointing. I am tired of dealing. My mastectomy was over a year ago, and I just feel like I've just been dealing with this whole thing for over a year now, and I'm just tired. So there's that aspect to it. I text my plastic surgeon. I was like, hate to bother you, but I believe my incision is completely open. Like, should I freak out? What should I do? So he was like, send a picture. That's what he always says, send a picture. So I sent him a picture, and he's like, don't panic. Put the neosporin, not the polysporin, and change the bandages every 3 days. And then I have to go in on Monday because he's not in the office on Friday and Saturday and Sunday. And he won't be in until Monday. So I have to go in where I assume he'll try to stitch it. What we are dealing with is after you have radiation, your skin is pretty compromised. So I know a week after my exchange surgery, he removed the stitches and everything was going fine. I felt like everything was going fine, and I was, 3 weeks post surgery at this point when the incision kind of the wound started failing. So, your skin is just, like I said, it's compromised after radiation. It's harder to stretch it. It's harder to heal and regenerate. It's all fucked up. So that's what we're dealing with. I don't know. I think I've put myself in a I've like psyched myself up is not the word. I don't know. I've just been trying to get, other people who have experienced this with their exchange surgery, and a lot of them are like, it never heals, and they end up losing the implant. Not necessarily sure how I feel about losing the implant because of the size difference between my two breasts right now. And, the implant hasn't, on my reconstructed side, it hasn't done what it's supposed to do anyway. Yet, I mean, it's still just 3 or 4 weeks after the exchange surgery. So, I feel like I'm staring down the barrel of the latissimus flap surgery, and I don't want to do that fucking surgery. But everyone who's done flap surgeries, whether they've done the stomach flap or the lap flap one, everyone, they have like amazing results from it. Like, they look great. Like, you can't even tell that their breasts were reconstructed. It's great. It's just, don't want someone cutting open my back. And that is just a whole lot of recovery. That is a lot of surgery and a lot of recovery. But then part of me feels like he did such a good job with the scarring itself. I don't know how to explain it. With, most people, when they do a mastectomy, they just cut straight across the breast and it just looks ugly. He did such a pretty job aesthetically with his little anchor cut and everything like that. It looks great. I mean, the thing that looks the worst is just this discoloration, this from radiation. But the work he did, it's phenomenal, and I feel like it would be beautiful results if everything would cooperate, and everything is just not cooperating. So I'm like convincing myself that I'm going to have this latissimus dorsi flap surgery, and being 3 or 4 weeks post surgery, I'm not excited about thinking about another surgery. When I went into this last surgery, I was like, yeah, I'm going to have this done and my body is going to be right for, summer. I'm going to be on the beach again. And now I'm just like, still not right. Which is not surprising. Most people who get reconstruction done has to get revisions. I was just hoping that I would be one of the ones who could have reconstruction and not have to go through all of this. And, so far that's not the case. So it's just a little frustrating, and that's why I haven't wanted to deal with it. I haven't wanted to talk about it, but right now I'm here with my right breast completely agape open. My incision is like supposed to be like, if it's like my thumb and hand, it's supposed to be closed. It's like that right now. So I'm changing that bandage and everything every so often until I go in to see him on Monday, and he, I guess, sews it back up again. And we start talking about the prognosis of, how this is going to be, or what this is going to be. But anyway, I feel like I'm rambling on, and I don't even really want to talk about this anymore. I'm just done. I'm actually extremely really bored. I've been in bed the whole time because I'm trying not to use my chest muscles, and because my reconstruction was on my right side, using my right hand, and I'm right-handed. Ow. yeah, I'm in a little bit of discomfort right now, but whatever. And then I can't do anything, so I'm bored, and yeah, nothing's on TV. But it is what it is. If anybody ever tried to convince you that like reconstruction surgery is like breast augmentation surgery, they're a liar. Kick them in the face. Like they are full of shit. This is terrible. This is the worst. But anyway, that's it. That's the follow up. I will follow up again after I see the plastic surgeon again. Talk to you guys next time.